Hi, ABA community, and welcome to another episode of the Radical BCBA. This episode is going to be the episode that reveals it all. Why did I go from OT to ABA or OT to BCBA? And the reason why it starts from the beginning, and I have to explain the beginning to y'all. And of course, I'm going to give y'all a visual this time so you could see my little hand flapping and explanations of this topic, because that is like one of the main questions I get. Like, why did you transition? Like, I'm stuck between both. And I have to start from the beginning just because I feel like I'm just finding out myself why I transitioned over and many other things. So let's start at back in the day. When I was young, I always wanted to be a teacher. But my dad's like, there's not a lot of money in that. You're not going to be stable. You're not going to be a teacher. So then I'm like, fine. Dad went into like nursing school, didn't finish. So then I was really intrigued by that. I was like, okay, maybe working in the medical field. Went and did nursing assistant. I was a nurse assistant for 4 years. And I learned about OT there. I noticed that I did want to go nursing route or like medical route, but something about OTs, PTs, and speech therapists, like being happy and having a different schedule than the 12-hour shifts that nurses had, I was intrigued. I was like, what do they do? I want to know, because I worked at a rehab unit. And I was like, who are these people? You know, I work night shifts, so I didn't really see them often. But in the morning, as shift change was happening, that's when they were coming in. And so I started to dig into that. And that's where I learned about OT. I did OT and I felt good. I felt like I am kind of like a teacher. Like, I'm teaching people to be independent, right? And I really liked that part. I thought I was going to go into adults only, ended up in pediatrics, and I loved it. Thankfully, I loved it. I don't know why I was scared of children. I think I was more scared of like the horror stories that I would hear from students going there for their rotations and like getting bit, getting scratched. Interesting to say, I did not have a pediatric rotation either. I had 2 different adult rotations. I wish I did have the pediatric experience, but deep down, I guess I thought I was going to do adults, but thankfully I didn't. There was no jobs after for adults. There was only pediatrics. So I had to go that route. And it wasn't that bad. Even after years of practicing, I did, come across a lot of those behaviors and, children on the spectrum that I didn't really know. One, I didn't even know about like autism and, the spectrum and things like that. I was fairly new to that. This was like 2018, 19, 20, and then pandemic hits, and then you're so isolated. So like a bunch of stuff happens in between. I remember during COVID though, it was hard. I remember just being very depressed and like not happy with my job anymore because it's that one-on-one, but then we're so isolated. And I just felt like, again, I just want to teach. I want to teach. So I was looking into like, how can I be a professor at a university? Like, I started to look like I want something different. I came across an RBT actually. It was a client that we shared, and this RBT would follow my client everywhere. Like, I was like, so what do you do? Like, why are you here in my therapy? Like, well, that's cool, right? Because I thought that was like someone like a family member or something. And she started to explain, well, I'm an RBT, I have a BCBA, she supervises me from the computer and things like that. And she was just explaining this. Again, I'm very new to ABA. I'm just kind of like, interesting. Started looking into BCBA things, like just to see what was the, how to get there. And I just, what I would shy away from was the 2,000 hours. Like, we had to, and I didn't understand, how would that be possible? 2,000 hours was going to take at least like maybe 2 years, depending on how many hours I could acquire. So there was a lot of like unanswered questions that made me still shy away from that. And that's it. I just like paused that. COVID hit, and I just like took a break. I wasn't really thinking about anything. Then all of a sudden, again, it's like this feeling of like, can I do more? Can I do more? Can I do more? Because in OT, you do a lot of like direct treatment. But that's it. You see the client twice a week. And then, somehow we did see a lot of progress. But I don't know. I guess I just started to come across more behaviors too. Like, I remember like, I started working in this multidiscipline like clinic. Amazing. I learned a lot of the stuff that I know through that clinic. But I noticed that I was given the most hardest clients. Let's just say the hardest, because I didn't think they were that hard, but no one else could really deal with those behaviors but me. And I was just very nonchalant. Like I didn't know what to do, but I also didn't push them, because I was like, I'm not trying to get you to the point where your heart is racing like crazy and you're just reacting. Let's just chill. Let's make this a calm environment. And so I would always take these very calming approaches that started to work. I didn't know, about Premack principle, first step. I didn't know any of that. I just somehow started to apply ABA. I'm not going to lie. I started to just apply it naturally, and it was working. But then again, you run out of ideas. I don't understand behavior the way I understand behavior now. So I was like, what can I do? Should I go through psychology? Like, let me look into something that involves behavior. And so this clinic that I was working for did have ABA, but we were separated. So down the street, like you could legit walk down the street, they had their ABA center, which I would go there to do OT sometimes during the Monday mornings, because they had like meetings there and they needed people to watch the kids and things like that. So OTs would travel there. I started learning a little bit more about it, and I started kind of seeing the BCBAs, and I was like, what is this again? I had no idea. And then one day I was like, you know what? Let me see if I could just shadow someone. I shadowed the BCBA, and the first thing that I asked her was, are you happy with your career? I started to ask that because, I see a lot of OTs get burnt out. I see a lot of PTs get burnt out, speech, and I wasn't even in that field yet. So I wanted to be sure, like, what's the burnout rate here, right? And she told me, I love my job. I love it. I'm happy. Like, this is the best decision I've ever made. And I just stood there like, I don't think I've ever really heard anyone say it like that confident, especially going through the journey you go through to become a BCBA. Like, I feel like I was already burnt out by the time I got out of school, right? That's when I was just kind of like, okay, let me get into it again. And I didn't really know. All I knew was that you monitored RBTs, and I knew that you taught them things, and it was just kind of like, maybe it can be kind of like a teaching role. Maybe, I don't know, right? I entered into a program, and that's where it all flooded in. That's where I learned that it was about a science. And I am intrigued by science. Like, I love all types of science, including anatomy. Like, I love the way the body works through anatomy. And that is the OT part, right? Well, now I get to learn a different part of science that works on behavior and understanding behavior. So I fell in love, and I was honestly hitting like my 5th, 6th year of practicing in OT. And at that point, that one-on-one, I was just kind of like, I think I'm done with that. Like, I think I did my part, and I love that the BCBA role was going to bring a different role where I can still make meaningful changes to clients, and multiple of them, because I'm not seeing them one-on-one anymore. Like, I'm actually able to then teach RBTs, to teach, clients, and then I still get to interact with the parents and teach parents. Do you see what I mean? Like, I feel like this opportunity was like, I get to hand over my skills, my knowledge, my everything that I want, that I feel confident about, to somebody else, for them to then spread that out. Like, it was like a mission. To be honest, it was like a mission. It was like, wow. I feel like as I got closer to receive my license for a BCBA, I started to kind of question, should I let go of my OT license? I don't want to be known as Michelle OT BCBA. Like, I really did not, because I feel like people were definitely a lot more intrigued in the OT perspective of me than of the BCBA version that I am. And I'm like, hello, like, I want y'all to see, like, I'm a good BCBA too. Like, I have a lot of knowledge in that. I mean, I tutor people now. I passed my exam first try. So it's like, I have a lot of this skill too. I'm starting to kind of soak that in, and I'm starting to realize that maybe that is my identity, is to have multiple things, blend those together to better support my client. It doesn't mean I was forgetting like OT like strategies. When I went through my ABA program, like, they were kind of like, if you use OT, that's wrong. wrong. If you blend things, that's wrong. That's wrong. That's wrong. And you're legit like programmed this way. You're programmed this way. You trust your professors, right? These are people who've been in the field for years. This is like the first generation of BCBAs, right? These are the older people who've been practicing for a while. These are the people that are telling you that. And so to me, I feel in a way guilt. I felt like I was doing something wrong. And then I finally entered the field as a BCBA, and I'm like, I'm in charge of this. Nobody else is. I'm getting results. Nobody else is. Because you know what? I can transform OT language to ABA language for it to resemble the same thing because we use automatic, because we use sensory, but in a different way. But I can show you how I can blend them together and still be ethical. And I started to feel this power again. And I started to love OT again and just to be okay with blending that and not feeling like I'm doing something wrong or something unethical. And then meeting other people like me, meeting RBTs that have the same passion, that work with Ascent, like beautiful. I felt so welcomed once I became a BCBA. During schooling, I was just kind of like, oh my gosh, like that means I have to let go of OT. Like I can't continue representing that. Because I'm gonna be honest with you, I am not practicing OT right now. I know a lot of people are asking, like, are you still doing both? Are you billing here and there? Well, the OT side, they're very friendly. They don't care if you're a BCBA. They're like, I'll be able to bill. Like I could see a kid for OT and then I could see a kid for ABA. But the ABA route, I can't do that. I can't be their BCBA and I can't do OT either. Like I can't with the same client. It would have to be with different clients. So it's ABA that's honestly tapping me there. It's them. So that's not the reason why I'm not practicing no more. I honestly don't want to do direct treatment anymore. I think I like the position that I'm in, and in OT, I will do direct treatment unless I do remote and I teach caregivers to do OT, which I did for 2 years as well. And I really loved it. But at that point, that's why it's like, well, I could still share my OT knowledge as a BCBA and doing, ABA, BCBA things. So that's why I feel like I'm okay just being a BCBA. I don't know yet. I'm still in between if I should let go of my license or not. I kind of don't want to sometimes because I feel like that will push me to continue to renew my license and do continuing education courses for OT. And if I do let go of it, I feel like I don't have this responsibility of continuing education courses to renew it. And so I feel like I want to still keep pushing because in OT, y'all, we have amazing continuing education courses. Like you fly out to these dope ass like presentations that are 3 days long. You meet awesome, cool like therapist, speech, OT, multiple different people coming together. I have taken neurological classes. I've taken reflex classes. I've taken feeding, I've learned about feeding therapy. It's beautiful. It's a beautiful experience. I'm still trying to find some. So please, if y'all know of any in ABA, I feel like there's just like a lot of conferences. I guess that's what y'all call them. I don't know. And then I guess you just learn a little bit about everything. I don't know if it's just not as in depth, because when you learn about reflexes, like we're actually visually learning about them, triggering them. We're all huddled together. We're learning like the anatomy and the body and all that. So I don't know, maybe ABA is not like that, but this is why I want to make continuing education courses, because I feel like it's really up to us. I always say that I think it's up to this new generation to create that. And I don't think we know though. I think the only reason why I have this passion is because I've seen it in the OT side. I've seen these amazing therapists come together to blend OT and speech, how to support feeding in both perspectives. And so you learn about the mouth. You learn about the mouth muscles that speech learns about. That's not our thing in OT. But then you get to have all this education blended together to get the best result. So what if I do that in OT and ABA? Because it can be very relatable if we're talking about the sensory system, the automatic, the sensory, our functions. Hello, I feel like the function of automatic and sensory is legit the last one to consider. It's always like it's escape and attention, or it's access or denied access, whatever. What about sensory? Like there's times where like you're getting all these, like your data looks a little wonky. Like what if it can just be sensory? What if it can just be like this respondent conditioning that got, this reflexive unconditioned response was now conditioned through the process of respondent conditioning. That means we're working on reflexes. That means we're working on behaviors that are unconditioned responses, that we're entering a whole different ballgame. So let's start going that route. And so now I'm like, dang it, it's going to be me. It has to be me. Like, it has to. But you know what? At the end of the day, with this whole story that I just told you, I think at the end of the day, I really just wanted to be a teacher. Like, I think that is my calling. And I always say I want to be a professor, and maybe I could create a class in the ABA like world and that can teach about discipline, bringing different disciplines together, working together. Maybe I could like organize that for universities and kind of have a class, not so much ABA related, but like, how can we blend? How can we work together? How can we bring other students in OT, other students in PT and speech, medical doctors? I think my fiance was telling me that she went through that in her university when she did OT. Like, she met doctors, speech and OT and all that, PT. But I don't think ABA was there yet. But like, that's what I can bring for the ABA world, is bring all of us together, because we are working with medical doctors, teachers, other therapies, because we deal with behavior. Why not psychology too? Shoot, let's bring all of them in, because behavior has to do with everything, right? Regardless if it's unconditioned responses or conditioned responses, it's still same thing, right? So at the end of the day, it has to be me. And yes, my calling is being a teacher. And I think that's why I for sure am where I am today. And, it's not so much because I didn't like the field. I love OT. It's more of like, if you're trying to make a decision, it's like, do you want to do direct treatment? Most likely you're going to do direct treatment in OT. I mean, you can get hired to do like just assessments, but again, you're still directly with them. I mean, so do you in BCB as a BCBA, right? You do directly the assessments, but I mean, you would have to find a job that just does that. And then you have like an assistant behind you just doing the programs, but it's hard to find OTs right now. And so there's not a lot of those job opportunities, because they rather fill in jobs that require that one-on-one, you and the client. So if you're trying to go for a BCBA, I feel like you have more of the option, because I know there's some people that do direct or misdirect when they go from RBT to BCBA. So I'm sure there is. Here in Texas, it's not huge, but I'm sure in other states it is. It's up to you. Do you want to do direct treatment? Are you done with direct treatment because you did it for so long because you're an RBT? You can then start to make those decisions based on that, because then you could kind of be in the back, right? Still making meaningful changes through programming and teaching and educating and training. The thing about it, though, is teaching comes naturally to me, and this role comes naturally to me because I have past experience. I've taken OT students with me before, so I've had this experience where I have been a teacher role, I guess you can say, and as a BCBA, I've heard and seen other BCBAs, be so lost. Like, yes, they teach us the importance of using ABA on RBTs, right? On anyone we work with to increase that responding, or making sure that, collecting data accurately and making sure that they are understanding our definitions. But it's different. It really is different. Like, not having the actual experience, but just learning about it, it's so different. So I can see how y'all are entering and are pretty lost, right? And you're still trying to find a way to manage your caseload, manage RBTs, manage your schedule, manage everything that comes with our responsibility. We have a lot, plus caregiver training, right? So then when do we even have time to learn that? When do we even have time to focus on that, right? Training part, especially with our RBTs. So it came a little more natural to me, again, like I said, because of past experience. I can only imagine being freshly new to this role, entering, if I felt the way I felt, this anxiety, right? This feeling of like, am I doing the right thing? Am I not? They're so focused on me just billing, but I have other concerns. At the end, the best thing you can do is find a company that really does implement education, training, continuing education. That is going to be your best route. I did that. That's why I was at the clinic that I was in that had all these disciplines. They would like give us a lot of money to go get continuing education. They even have a list of where to get training and what they would want to see. So you get to choose. There's a big list. You don't even have to look for them. All of them were listed there, and you just choose one, and then you find the date that you want, and then they approve it and they pay for it or whatever. Beautiful. And so that is one thing I am going to continue to let y'all know is find these places. So how do we work together to create, successful support in this environment that we're all going to be working in, including you, the CEO, and small, I would say smaller companies, like in the middle companies, because I know sometimes people work directly with, BCBAs who own things and stuff like that, and they haven't had the best experience. But then I also know corporate places, the same thing. So it's so really look into that. I wouldn't work for a corporation anymore, to be honest with y'all. It doesn't mean that there's not good ones out there. I'm sure there is. I think it just depends on who's managing them. But at the end of the day, the point isn't just always about billing. It's about working as a team to make these changes for you to feel supported, for you to be able to learn, for you to be able to have this drive for your career, right? You want to keep pushing for this career. You want to find why you fell in love with it. And yeah, I hope that helps y'all. And I hope that really does break down the difference between these disciplines for y'all, because, PT, OT, and speech are all direct. As a BCBA, you can choose to be direct if you want to, I think, in some states. What else? In psychology, I heard therapists, like psychologists. Yeah, psychologists, not psychiatrists. Psychiatrists are doctors and they make a lot of money. Psychologists also are starting, especially here in Texas, they're starting to not bill insurances because they're not paying. Insurances are not paying for them, so they're losing out on money. And the way it works is you submit your form of this client who you just saw 2 weeks ago or whatever, and then they could still just deny it and you never get paid. So they're starting to do more like out-of-pocket pay. I know the psychology world is struggling a little bit right now, but you know what? They found ways to even make more. They found programming. They found something. They're thriving. They're thriving on their own. And let's go into the ABA, BCBA route too. I think if I have my own company, I don't want to build insurances. You guys, I don't even have health insurance. I pay a doctor monthly to keep up with me, because I asked her, I was like, okay, what happens in the future, right? Because I don't have insurance. Like, what if I need to go to the hospital? What if this? What if that? She goes, well, that's the whole point, preventative care. Let's try to prevent that. Let's try to prevent. A lot of times when you go to the ER or something happens, that you didn't take care of yourself, or there was an injury, right? Let's say. But I liked her answer, and she stays there with me as long as I need. She'll talk to me. Like, she has so much time. Like, I can see her, text her whenever. Like, beautiful. I rather pay her monthly what I'm gonna pay insurance company monthly and still have copays and still have this horrible doctor that sees you for 10 minutes and then out of here. You don't even have a relationship with them. This approach that my doctor has is amazing. I love that. I'm like, I want to give you my money because you have a purpose and a reason, and you're here because you care. And so to me, it's like, I don't even want to deal with the insurances either. Like, I'd rather not. This is if I go like my own way, which right now I'm not. Right now, again, I'm still trying to figure out, like, what am I going to do? Like, do I want to continue teaching? Do I want to go, educate others, create continuing education courses? I'm still practicing as a BCBA full time. I work for an amazing company. It's owned by a BCBA who has a lot of passion. Yes, she bills insurances, but I'm not dealing with that, like, I'm not in that area. So I'm good with that. But other than that, again, still very undecisive Michelle here. Y'all will hear that a lot too, because ADHD, like, I'm always bouncing around. But the good thing is that I take it all with me. And as y'all get to see all this flourish, y'all will notice that you guys are legit going through life with me as I'm trying to develop who I truly am. I know sometimes y'all look at my social media and y'all be like, oh, she got it under control. Like, she knows who she is. Like, I'm still trying to figure out where this is even gonna go. It's a little like nerve-wracking but exciting, But y'all are so gentle. Y'all are so soft. Y'all are so respectful. Y'all show so much love that I feel safe in this ABA community. And it just pushes me for more of that because you never know. Social media is scary. Like, people are scary. And I notice the ABA world is just so welcoming. And I really do appreciate that, y'all. Like, I haven't heard anyone sit there and be like, oh, you shouldn't bring OT. Oh, you shouldn't do this. Oh, you shouldn't do that. Like, it's just been like, give me more, and give me more. And I love that. It really does help me start making decisions and choices. And y'all, in a way, guide me to these things. And I appreciate it because y'all have seen something in me that I thought I saw in me for so long. But I guess I just didn't know how to reach that until y'all were there to do that for me. So I really do appreciate all of y'all being here and following my journey. I've known people who have been following me since I've posted videos about, go through my journey of studying for the BCBA exam. And now we're here. I just passed my exam in February. This is what we're in August now. Oh my gosh. February, March, April, May, June, July, August. Y'all, I'm celebrating 6 months as a BCBA. Oh my goodness. And I've been tutoring as well. Tutoring's going great. I kind of took a break from it. Like, not a break, but people like we just kind of slowed down. I'm not taking any more and things like that. But I do miss it and I do like it. So I'm just kind of like, but again, I want to commit to my caseload, right? So there's just a lot going on. But again, I did 2 podcasts that should be dropping this month. And I'm excited because y'all get to learn a little more OT stuff. That's why I'm like trying not to give y'all everything because I've already kind of talked about it more. Or maybe it's the same thing. I don't know. Hopefully not. But if y'all have questions, let me know. Put them on the comments. Tell me, because that brings more topics to me, like for me to talk about. Like, I didn't know y'all were really intrigued as to why I transitioned from OT to BCBA, but it makes sense. It really does make sense. Like, it's really important because I've heard RBTs are like, I don't know what route. Should I go speech? Should I do OT? Should I do ABA? Because they've seen it all. RBT's seen it all. They see people come in and provide these services, right? Or there's feeding therapy too. There's so many therapies. So they're like, I don't know what route to go. But just remember that in ABA, it's about behavior. You can go any route. You can go anywhere. You don't even have to do like the basic ABA stuff. Create this company for yourself. It's behavior. Imagine you can change behavior. Imagine you can help a company, do something that I thought about is like creating like customer service skills, like training people in companies and things like that for customer service skills. Because if you don't have customer service skills, like what happens to the things you're trying to sell, the things you're trying, your company and things like that. So that's all behavior, y'all. Are they doing safety awareness? Are they wearing the helmets the way they should be? They already had like 3 people, hospitalized. They're losing money. Trust me, they'll hire you, especially if you say, I'm a behavior analyst. I work with behavior. I can change behavior. They're going to hire you. You just have to, again, what skill do we have? It's everything you can think of. Behavior's everything. Every single thing. I'm really into respondent conditioning. I'm really into those unconditioned responses and things like that, our reflexes, our survival. I want to dig into that as well. So I'm excited for the podcast, The Diary of a BCBA, which is coming soon. It's going to be me and my co-host Yaneli. We're both BCBAs and we're going to nerd out. I think our first episode is probably going to be on pairing, but we want to educate y'all on these topics as to like how to do it, how to support others doing it, right? Our RBTs pairing, how to pair with caregivers, right? So I want to pick a specific topic for me and her to talk about, and she's amazing to talk about. If you haven't seen that last episode, she's amazing. Like, we can nerd out like crazy, and her perspective is just so unique compared to mine, and being able to talk to a BCBA just like that is beautiful. I learn from her, and I know she learns from me. And so yes, with The Diary of a BCBA, y'all keep updated. Yami is going to come out now. That is a podcast with me and my fiance. It's called Yami for Yadi and Michelle. Yami. That one's going to be coming out soon. That's a personal one. We're going to have 2 segments. One of them's going to be about parenting called No Manual, Just Vibes. And then we're going to have an ADHD segment where we have ADHD highlights, funny ones. How do we get through our day? You know, like how do we struggle? How did we struggle growing up? How did we go undiagnosed for so many years? Because I have ADHD in my timeline. My brother had it when he was young, or like the diagnosis. He still has it, right? But the diagnosis. So very interesting. I'm excited for Yami. It's actually, it's already on Spotify. I can go hit that follow button, and I have like a little intro to it too. And I'm excited for that one because y'all get to see a personal like perspective of us. Like, we're two queer moms. We're both ADHD, OT, BCBA. Like, she practices OT too. So come on, y'all. That's dope. Anyways, guys, thank you so much for being here. I'm so excited, like I said. And thanks for all the support. Bye.